Thank you for joining us today on the program, Healthy Living. I'm Adesuwa Osa Owagie. Today on the program, we're going to be looking at Lassa fever. And you and I know that Nigeria, Lassa fever is endemic in Nigeria. And this is about the annual peak of Lassa fever, usually during the dry season between December and April. And some persons are still living their stuff carelessly for rodents to, climb on and sometimes even defecate on. So today, we're going to be looking at Lassa fever, what causes Lassa fever, what are the signs and symptoms, gestation period, the risk factor. We also look at treatment and cure of Lassa fever, and at what point does it lead to death. These are what we're basically going to be looking at today on the program Healthy Living. Joining me today is Dr. Jenyiye Hitler. Mr. Jenyiye Hitler is the State Health Promotion Officer and also the risk communication team lead. Risk communication team lead here in Edo State. He's from the Ministry of Health here in Edo. Happy to have you join us. This one that you're already cresting your Lassa fever t-shirt, the awareness now, not be small. All right, talk to us quickly because time is not our friend. Let's look at Lassa fever. Holistically, now what would you say Lassa fever is?
Yes, the first concern that I have before I talk about what Lassa fever is the speed at which it is hitting this Utah season. Utah season. Yes.
So all the rodents are in the house and everywhere with us.
Yes. Aside from the fact that it's dry season, is festive period. People tends to be a little bit relaxed. People tends to be a little bit carefree. So all those are some of the components that have influenced it. Presently, as we speak, as at 7th of this month.
Of January?
Yes, January. Okay. Yes, we are already hitting 17 confirmed cases.
17 already?
17 already as at on the 7th of this month.
It's not as if Lassa fever is a new thing in Nigeria. Year in, year out, we talk about Lassa fever. There's so many advocacy programs going on Lassa fever. Yet, people are so relaxed. What could be the reason for this?
Yes, you see, first, Lassa fever is mainly an hygiene-driven disease. Okay. That means that, yes, the treatment are available. The test is free.
Okay, test is free.
Yes, test is free. The thing is, even if those things are there, once a particular disease is now relying on the hands of the people.
Yes.
Millions of people have to behave well before it has to be eradicated. It becomes a problem. So if someone in this household, maybe 90% comply and 1% or 10% do not comply, those that do not comply, we bring the problem to everyone.
To everybody.
So that is where the issue is. Yes. That's where, even when you even look at being contagious, Lassa fever is not that contagious in the sense that it is easily preventable.
Okay.
Okay. When a rat poo-poo on surfaces, at night while we sleep, that is where they come out to look for food. Because presently, their houses in the bushes are being invaded by bush burning. Every corner you turn to, you see bush burning.
Yes.
Even a small plot of land that you can clear and be able to maneuver, you see everywhere, even within the city, you see everywhere being burned down. Now, if your house is being burned, what will you do? The rat comes to the house for basically two reasons.
Okay.
They come to the house for shelter. They come to the house for food.
Okay, now let's quickly describe this rat that brings Lassa fever.
Yes, the rat that brings
because it's not every rat.
Yeah, the rat that brings the Lassa fever, or rather carry the virus, is the Oyinbo call it the multi-mammal rat. That is the one that have plenty breast. But however, it is possible for that rat to infect other rats. So as long as you are in the endemic area, because there is a region, the Edo North and the Edo Central, some part of it, that are endemic, that have this species of the rat. As long as it is that area, you don't have to, even the attempt of trying to find out whether the rat that I'm seeing is the one that have plenty breast, we create room for infection. Yes, because because you are not supposed to touch the rat or get close, because in the process you get your hands contaminated. And once that happens, you will have to rely on hand washing in order for it to remove from your hand.
Okay, so how do we identify Lassa fever? What are the signs, what are the symptoms? Signs and symptoms of Lassa fever.
Yes, the signs and symptoms, this is where another issue is. You have the fever, you have headache, you have chest pain. Some, the only thing they complain about is stomach pain, some back pain, muscle pain, and feeling of dizziness. Okay. Feeling of dizziness, feeling weak. And if you look at all this, these are the normal symptoms of malaria. Yes. These are the normal symptoms of typhoid fever. So the major problem is that before it will get to the other side, other stage, where you begin to see symptoms like bleeding from the eyes, bleeding from every other opening, because at that point, body organs have been damaged, blood vessels have been destroyed. So if someone has to wait for that time, it's going to create dangerous outcomes.
So what do you advise? So once someone starts feeling all those headaches, stomach pain, chest pain, and all of that, thinking that it's just normal fever?
Yes, what is being advised is that as long as you are in that endemic area, once you have those symptoms, you are advised to go to the nearest health center to test whether it is malaria, to test whether it is typhoid, or to test whether it is Lassa fever.
You and I know that in this part of the world, it's difficult for somebody to say, you know, when you come down with malaria, test is the last thing on your mind. You just want to rush to the nearest pharmacy, get anti-malaria drugs. You can Google anti-malaria drugs that you think is okay for you, and just go and buy over the counter. You know, so what's your advice in this area? Just buy over the counter and then take, and then you're about your business all over again, not knowing what you might have.
Now, that is what we are campaigning against. I want to use this opportunity to thank ITV for always providing opportunity like this for which to talk to the public. In the Ministry of Health, what we campaign against is that there are some basic rights that you have, which we want patients to be conscious of. You have a right to know what is the problem before taking up anything. It's a basic medical principle. So you don't just wake up because you feel the symptom, go and treat malaria. Even malaria, before you take any medicine, you have to know whether it's, even malaria have category, whether it's +1, +2, different.
Hospital is usually the last resort, when there are pharmacists and chemists everywhere.
So that is why we are appealing, but most especially in this endemic area. In this endemic area, and especially at this period, even health workers in that area, we are advised that immediately for their own safety as well, because right from the history of Lassa fever, because of its close range with malaria and others, tendency to be lackadaisical about it may come in. So because of that, to be careless. So because of that, health workers usually go down. So the advice is we are appealing. That is why we are using this medium to appeal to people to go for tests.
Particularly in the area
yes,
where
particularly in those endemic areas. Even if not in those endemic areas, it's a best practice. But I wouldn't want to, I want to focus on those endemic areas because that is where it's shocking us on the neck at the moment. So we are appealing that immediately you test. Test is free. You go for test.
What are the centers for test now? Do we have in Benin?
Yeah, basically we at the moment it is IRA Specialist Hospital, but we have a system in place. Once you get to an S center, we have a system in place for sample collection and sending of sample. Although arrangements are in place for UBTH and order to pick up, but that is beyond the purview of this our discussion. But basically, it is once you go to any health center, once you get to UBTH or any other health center, sample will be collected. Yes, sample will be collected. Even private facilities that are caring for patient, malaria patient and other, are advised to take sample and send. Each of them, they know the number of the state DSNO, the local government DSNO. These are the various channels that are already, health workers know this channel. As long as you are practicing in Edo State, you know the channel. Collect the sample, send the sample within a day or thereabout, based on a logistic issue, you get the result out. Now, what that means is that within 14 days,
that's the gestation period now.
No, the gestation period is within 6 to 21 days.
6 to 21 days.
Yes. Okay. So if maybe someone gets infected today, within 6 to 21 days, you begin to get the signs and symptoms. But okay, the challenge also is that majority of the cases are also asymptomatic. What that means is that some will have it, but they will not show symptoms.
Some they don't present symptoms.
They will not present symptoms. They will just be going on normally. That's why body system varies. So the few cases that show symptoms are the ones that get to the testing side. But in all, once a person has those symptoms, we appeal that he go for test. That's why test is free, so that once it is tested positive, one of the challenges that we have in the field is that once a person, the first stage is self-denial. If you tell someone that, this thing is more than you are taking a malaria drug
it's not my portion.
Exactly.
we fit almost everything.
Yes, everybody wants good health. Yes. But the truth is, you see people after testing positive, that is where the whole drama starts. You see them running to some urban center where they feel they can get it done. You see them running to other places. And in the process of running, you are contaminating surfaces along the way, because most cases, such person will be less careful.
All right, let's look at treatment and care now.
Yes.
After the testing, but eventually the person is positive, what's treatment like, and within how many days?
Yes, research shows that within 14 days, most fatal cases, fatality, that is cases of death, happen within 14 days. So any minute, any hour that is missed outside the hospital, you are creating more problem, not for only yourself, but the society. Because mind you, this is a virus that is eating up body organs. And body organs, as we all know, their surfaces are not as strong as the skin, that we have. So it is because of the eating up process that we begin to have bleeding here and there. So any day missed in denial is creating more problem for the body system. For crying out loud, the body system is fighting at the moment, fighting for survival. All the defense system are activated, but obviously they are being overpowered. So they need support. That is not the period for you to go to one traditional center to try and lock. That's what happened over there. I think I tried it on this person, and it works. You know, the body system has a way of fighting back, and maybe even without treatment, some, based on their strong immune system, may come back, and a person will claim that, oh, it was this that I used, and that will create problem. So coming back to your treatment are available. Treatment are available.
The treatment for Lassa fever, is it also free?
Yes, as for it being free, I can't say, But when you get to Irua Specialist Hospital,
yes,
especially at this outbreak period, why I cannot say it's free. The only thing I know for now, the testing is free. No one is going to turn you back when you arrive at the Irua Specialist Hospital.
So that seems to be the headquarters for the treatment.
Yes, once you come to Lassa fever, Irua is the headquarters. So immediately test positive, immediate support may be given by the health facility, but the direction that the care is going is Irua Specialist Hospital.
All right, Hitler, if we can do this in another 2 minutes thereabout, what are the things we should avoid as citizens of this great country, particularly Edo State, to avoid this scourge of Lassa fever?
Now, the main focus is our foodstuff.
Okay.
Yes, we talk about deratization, which involve killing the rats. But I must be very honest with you. No one can boldly say that he has cleared rat out of his home. If you want to test your success rate, just wake up carelessly by 2 in the night, and you may be surprised at the unscheduled
I'm going to
meeting.
disagree with you on that, because most homes don't have rats. There are so many homes that do not have rats.
Yes, it is true that clearing out rats is possible. Why the perspective I'm coming from is from those endemic areas. Mind you, we are dealing with rural area where they are, even you assessing the home, you see that all the openings are everywhere. So even if you kill today, which it is expected, we advocate that you kill the rat, but one cannot be sure that that will be the case. So that is why the appeal, the major appeal is hygiene. The food stuff have to be covered. The food stuff have to be covered, because you cannot be 100% sure that you have succeeded, because there are so many openings. And my rats are very smart, as long as you are in a very endemic area. So, let's stop bush burning. Because this dry season, everybody's burning bush, and these rodents need to shelter. And also we appeal that people clear their homes. There should be regular clearing, where those boxes that you have kept Christmas clothes, mind you, Christmas is still ahead again, leaving them there, and some pot that you have not used for a while. These places become places for these rodents. All
right, Hitler, thank you so much for finding time to come educate us on the need for us to be very careful, particularly those in the rural area, to make sure that we keep ourselves healthy and save others within our environment. Hopefully we'll do this again in no distant time, because we're still in the dry season, and dry season will end like April thereabout. So between now and that time, maybe we'll do this again to create more awareness for that person out there who is still very careless about this. All right, guys, this is all we're going to do today. Thank you for being part of it. We'll see you again on Monday.